Hi, this is the lab YouTube for PO and medication administration. The prep for this lab will be the Mosby's videos per usual, and I have them listed there, those that what you need to watch and to complete the review questions. The handout has some readings on it, and then we're going to complete the prep with some medication write-ups that I will go over with you at the end of this review. Nurses must apply knowledge, technical skills, and judgment when giving medications. Knowledge about, they need to know medications inside and out. Technical skills, it's not just opening a package and giving a pill or whatever, there's more to it. And then also judgment. You need to use your experience, your judgment, your understanding of the patient situation when you're administering medications. I want you to review the 3 checks and the 6 rights. And as always, check your allergies and kind of ingrain that into your repertoire, because that's what you'll be using every time you give medications. The 3 checks, as you know, includes before you pour, mix, or drop a med, after you prepare the med, and then at the bedside. You're going to be checking each med 3 times to make sure that you have the right dose, right. You have the 6 rights, right? Medication, patient, dose, route, time, and then again you'll be doing the right documentation afterwards. You can see in the picture here to the right that the nurse is checking the name tag. You need to ask the patient's name, date of birth, and identifier, and check the name tag. Several ways to administer medications and actually getting your medications ready. On the upper right is a machine called a Pyxis, and you can see that there's a screen in that machine. That screen actually has the physician's orders, medication orders in them. You can double check those orders to the medications that it actually has in the drawers. In this Pyxis, for example, the medication that you're asking for, the drawer pops open electronically and then opens again to where that medication is actually stored. You still need to do your 3 checks and your 6 rights. Lower left is a nurse that is using a barcode scanner, scanning the name tag of the patient, and also you can scan medications too, as they have barcodes on them. You'll probably be using this in your career, not to maybe even before you graduate from here. This is a typical med card, non-electronic, but it does have locking mechanisms on it where you store medication, and also syringes. All the equipment that you need to give past medications, and then on the upper right here is what we call a MAR, or a medication administration record, that has all the meds that orders or prescriptions for each patient. And it's a paper way to do things, and that's what we will be doing in lab. We'll be practicing that way. Some of you may still be using that way in your facilities this semester. Some of you may be using electronic. This is a sample of some drawers in a med cart. It's done by room number, patient name, and as you see, anything pretty much can be kept in the drawers. So each of you will have a drawer full of medications in the lab also. Several ways medications come. Unit dose medication, I believe, is probably the most common that you'll see these days, and that each drug is packaged individually, labeled individually, may even have a barcode on it, and that is done for safety measures. You can also have bubble cards or punch cards. Lower left, you can see the pictures of the medications, each card having a different medication on it, individually wrapped. And you can take and pop those out directly into a med cup if need be. And the med cup on the lower right, it does say it goes up to 30 mils. I just wanted you to see that, so you can put liquids in that or medications. Now, I just want to take a second and talk about the language of science. Medical terminology and the language and the science of medicine, it was developed originally with the Greek and Latin. So a lot of the words that we will use, all the little bit of the terminology that we use, will be in this case Latin and root. You can see some of the words that abbreviations that are here: AC before meals, Cap for capsule, that's pretty straightforward. PO is something that you'll be seeing all the time, and that's by mouth or per os in Latin. You certainly don't need to know the Latin for this, but I thought if you understood where these abbreviations came from, that they would have more meaning for you. PRN, for example, is as needed. You may take this medication as needed instead of as specifically, say, Q2 hours or something like that. So just wanted to give you a little heads up on the abbreviations that you'll be running across. Stock bottles may be used also. In this case, you have a bottle of Lasix in the lower right. You've got it 40 milligrams. There's 500 tablets in there. It has the expiration date on it. You need to check the expiration dates on the package, on any package, especially on something that has been opened. You need to pour the correct number, the best you can, into the lid of the bottle and then return extras. This way you don't have to touch the medication at all. We will practice this in lab, and then actually meds go into the med cup. We do need to, on occasion, split or crush medications. You can split scored tablets only. Lower right, the Xanax is a scored tablet, and that can be cut easily. There is an example of a pill cutter. Lower left, we'll have those in lab for you to use. We also, on occasion, have to crush medications. You need to know the difference between tablets, enteric-coated tablets, and slow release capsules. Those cannot be crushed because you change the pharmacokinetics when you do that. The absorption rates are different, so you cannot do that. But there are certain meds that you can crush, and sometimes you have to because your patient may not be able to swallow them. Always check to see if you can mix it into something and make sure that that is compatible with what you're mixing. Liquids may come in stock bottles, or they may come pre-packaged, as in this oral syringe here on the right hand side. Make sure that the medication is well mixed. Make sure that when you remove the lid and set it down, the lid is placed up on the counter so you don't get the lid dirty. You palm the label, which means you put your hand over the label, so when you actually pour, there's not going to be any drips that actually go onto the label of the container. And you also want to make sure that you measure accurately. We'll be doing that in lab. So be sure to review other meds too. We'll be going over these very, very quickly in lab, but ophthalmic, otic, transdermal, sublingual, etc. Each medication is given differently, and there's nuances about each med, so make sure that you familiarize yourselves with those too. You will probably be using that in doing them in clinical. And remember, as we talked about a couple of labs ago, universal steps for all procedures. And in this case, the procedure is administering medications. Make sure that besides remembering the 3 checks, the 6 rights, you're going to remember universal steps too. What do you do before you approach the patient? How do you prepare the patient? What do you do during the procedure and after the procedure? So you're actually building your skills when it actually comes to the procedure, not just giving the medication. What else do you need to do in each time you do a procedure with a patient? Make sure that you're able to explain any questions that they may have about the medications. Are there any parameters like the pulses or blood pressure that you need to check before you administer medication, or should you not administer the medication based on some nursing judgment? Make sure you offer water first if they're PO meds, and if the patients can sit up, have them sit up for at least 30 minutes afterwards, and it aids digestion and the absorption of the medications. Always document after, not before, and you'll see what that means when you get into the clinical setting. I'm also going to mention here the QSIN, the Quality, Safety, and Education of Nursing. In this case, we're talking about medication administration. In this, we want to create a culture of safety. So often that if there's an error, as Lynn had mentioned in her lectures, if there's a medication error, you don't want to use the word blame. You actually want to look at why was that error made? What was going on at the time? What systems were in place? Were you at the med cart and you were interrupted 5 times? Or were you rushed? Did you not have the correct tools to do your job? So we're actually looking at things like packaging, names, dosing, correct writing, and even in the workplace to look at you need to create a safety net for you when you actually give these medications. So I challenge you, what are you going to do in your practice to create a culture of safety for yourself? How are you going to make sure that it's not just reading and giving pills or pushing pills, as some people say? What is going to be your culture of safety? We will be discussing that in lab. And lastly, your homework. There's a couple of med sheets you need to complete and bring to lab. The scenario: Sydney Collins is admitted with hypertension, and you're going to be caring for Sydney. The meds that you'll be writing up is the orders 20 of Lasix milligrams PO daily, and the potassium chloride 20 MEQs PO daily. This is the sheet that is posted that you will fill out and do the best. Get your we'll go back up there, as far as get your Davis drug guide out and fill out these things. What are the major side effects that you may see? What are specific nursing considerations when you're giving this drug? So this will be your first attempt at actually doing this. So do your best. We'll bring it to lab and we will be using it in our lab. So if that's the end of this YouTube, if you have any questions, please bring them to lab or shoot me an email. I'd be glad to answer them for you. Thanks.